Hey guys, welcome back to HAAD Academy. We make medical education simple, easy, and affordable. Subscribe for more videos. Did you know multiple sclerosis is one of the most common causes of neurological disability in young adults? Let's break it down together. Multiple sclerosis is a chronic autoimmune disease where the immune system attacks the central nervous system, specifically the myelin sheath that protects nerve fibers. This disrupts the flow of signals between brain and body. Now let's look at the types of multiple sclerosis. Relapsing remitting MS, RRMS, the most common type. Symptoms appear and then improve with periods of recovery in between. Second one, secondary progressive MS, SPMS, starts as RRMS but gradually gets worse over time with fewer recovery periods. Third one is primary progressive MS, PPMS. Symptoms slowly worsen from the start with no relapses or remissions. What causes MS? Well, no one knows for sure, but experts think it's a mix of genetics and environmental triggers working together. MS doesn't just appear out of nowhere. Certain factors can increase the risk. It's most commonly diagnosed between ages 20 and 40, so it often affects young adults. Women are more than twice as likely to develop MS than men, which is pretty interesting. If a close family member has MS, your chances go up. Some viruses like Epstein-Barr have been linked to MS, and even where you live matters. MS is more common in cooler climate areas. MS symptoms can be really unpredictable. One day you feel totally fine, and the next day, even simple things like lifting a cup or walking upstairs feel like a struggle. That's because MS affects the nerve, and depending on which one is involved, symptoms can be different for everyone. Some of the most common symptoms include fatigue, feeling completely drained even after a full night's sleep, numbness or tingling sensation, especially in the arms, legs, or face, muscle weakness, making everyday movements harder, vision problem, blurry or double vision is very common. Cognitive changes like trouble focusing or remembering things. Diagnosing MS isn't as simple as taking one test. Doctors have to piece together different clues to figure out what's going on. The process usually involves MRI scan to look for lesions in the brain and spinal cord, spinal taps to check for specific protein linked to MS. Other tests rule out conditions with similar symptoms. MS can look like a lot of other illness. Early diagnosis is a key. It helps doctor to start the treatment sooner, which can slow down the disease and improve quality of life. Okay, so the big question, can MS be cured? Right now, the answer is no. But the good news is, there are treatments that can help manage symptoms, reduces episodes of worsening symptoms, and slow down progression. Disease-modifying therapies. This helps lower the number of relapses and prevent new damage in the brain. Corticosteroids, used when symptoms suddenly get worse to reduce inflammation. Rehabilitation. Physical therapy can help maintain mobility and strength. Managing MS isn't just about medications. It's also taking care of your body and mind. Small lifestyle changes can make a huge difference. Exercise, even light movements, helps maintain strength and flexibility. Balanced diet. Healthy eating supports overall well-being. Managing stress. Stress can trigger symptoms, so things like meditation or just getting enough rest are super important. Alright, that was a lot of information. But here's the takeaway. MS is complex and challenging, but with the right treatment and support, people can live fulfilling lives. If you found this video helpful, give it a thumbs up and share it with someone who might need this information. And if you have any questions or personal experiences with MS, drop them in the comments. I'd love to hear from you. Thanks for watching, and I'll see you in the next video.